Hello, I'm Lene Rule from TravelNurseSource, and today I'm here with Frank, who's a retired nurse. With 50 years in nursing under his belt, Frank is a major influencer in his profession, starting and leading many emergency medicine initiatives. Today, he speaks throughout the country on various topics, including gender diversity in medicine, which is what we're going to chat about today. Frank, tell me a little bit about yourself and why you got into nursing.
Well, at age 19, I was attending the University of Dayton, majoring in dietetics, I believe, and I hurt my back my freshman year and wound up in the hospital and was in and out of the hospital for quite a while because they couldn't find out what was wrong, and then they did some tests, and that made it worse. And the bottom line was, while I was in the hospital, I developed this affinity for nursing. I had two aunts at the time. I had two aunts at the time who were nurses and very dominant figures in our family. Two of my mother's 8 sisters, I might add, and 7 brothers. And I also had a nurse, a guy who was a nurse taking care of me, and he was rather impressive as a guy and as a nurse. And he would ride with the local ambulance at night and come in and tell stories in the morning of what he did last night on the ambulance. And that, to me, was intriguing. But as I also was in my recovery there, I was going back for physical therapy, and I would visit some of the patients that I was on the floor with when I was there, and just saw this, it sounds corny, but I had a calling. The calling was, you should be doing this. You should be helping take care of people. So I returned back here to Pennsylvania, which was my home, and enrolled in nursing school. Was working at a hospital waiting to go to Philadelphia College. It was Philadelphia General Hospital School of Nursing and a diploma program. And the hospital was part of a foundation that had started a college of nursing, and they sort of recruited me to go there and convinced me it would be better to go and get a baccalaureate degree as opposed to just have the diploma RN. And so I did, and I went to school at that hospital, and the hospital eventually sold the School of Nursing to a local university, now Widener University, and that's where I graduated in '71. And I just felt that it was something I wanted to do. I coupled that with the fact that I really liked emergency care. I had been riding volunteer with the local ambulance, as my nurse mentor had done back in Dayton, and saw a need to do things outside the hospital, and that the ambulance was a place to do it. The dean of our nursing program, who was one of my greatest role models and mentors in life, had a famous quote, and that was, "Take nursing beyond the hospital." She was heavily involved at the time in what was called public health or home care nursing, really well ahead of its time before home care nursing was what it is today. And so I sort of combined home care nursing with emergency department nursing and came up with the idea that I could get involved in what eventually became EMS. So I worked as an emergency department nurse until we started the EMS program in the early 70s, and then did that. Went back to the emergency room for about a year in there somewhere, but then back into EMS and stayed in emergency care outside of the hospital, but still using my nursing credential up until I retired 2 years ago.
Very cool. And when you went to nursing school, were there a lot of men going into the nursing field, or was that rare for that time?
No, it was rare. The time I enrolled in nursing school, which was '67, 1% of nurses in the country were men. When I graduated, it was up to about 2%, 2.5 as I read in the literature. So it was a very rare thing. But I didn't care. I was going to do what I wanted to do, and went ahead and became a nurse.
Right.
There were obstacles, and I and many nurses had to battle through those. Many guys who were in nursing, but it was it was a time when the feminism movement was just beginning to blossom, and so we were sort of doing some reverse feminism, saying we needed some maleism in the nursing profession, and we stuck to our guns and moved ahead.
Can you go in a little more detail about the kind of obstacles you faced? I mean, I think we can all assume some of them, but just to kind of get a feel for what it was like being a male nurse in the 70s.
Well, I think one of the obstacles was the fact that it was viewed as something that normal men didn't do, and that the men who were nurses were homosexuals. And at the time, of course, there was such a terrible stigma with homosexuality that we were all seen as homosexuals. I wasn't. I had friends who were, but I wasn't. So it wasn't just for men who had caring attributes. Many men care.
Right.
But the profession was so dominated, and since the time of Florence Nightingale had become so dominated as a women-only profession, that many of the women in it really weren't sure how to deal with men in the profession. And so there was the traditional male-female clash came about. Not so much in my fellow students and eventually my colleagues, but in administration and in education. The nursing professors were not sure. There were schools that wouldn't accept men. I actually just yesterday met a nurse, a guy, and he was proud to show me. When he found out I was a nurse, we got talking. In fact, I was a patient briefly in his ER for a problem with my leg. And he proudly pulled this letter out of his wallet from a school of nursing in 1978 that rejected him because they didn't take males. And he was rather obstinate. He was already an LPN. He wanted to become an RN, and he battled through and had them accept him. And now has had a very successful career in clinical nursing, and has 3 sons who are nurses. But it was a battle for many of us at the time to make it in an all-female world. Sexism was prevalent, and maybe it should be called genderism. People would make comments to me like, "Oh, we need more men in nursing because these patients are heavy." To which I would respond, "No, we need more pretty girls so that the men can see them." People didn't think of that. That we weren't just for our muscles; that we also had other attributes. And most importantly, that we brought gender balance to the profession. And that really, one of the things that I lecture about is not why we need more men in nursing, but why we need more gender balance. Because men and women together can accomplish things that by ourselves we don't, because we're different. Despite the fact that everybody's quote-unquote equal, the reality is we're different. We're different in personality, we're different in attributes. And while there's always exceptions on both sides, the reality is it's that balance that makes good parenting, and in reality makes good nursing as a team when we have a gender balance, as we need to with other groups that are not prevalent. I'm shying away from the word minority because I don't
Right.
like that word. I'm not a minority. Minority to me implies something that's not good enough or not equal. I'm a nurse. By the way, I don't use the term that I'm a male nurse. I'm a nurse. Are you a female writer?
No, I'm just a writer.
Are you a female? Are you a woman driver?
Maybe. No.
We sort of put gender names on something when we want to accent the negative. I'm a nurse. And my nursing degree says nursing. It doesn't say man in nursing. Yes, I'm a man, but I'm a nurse. My profession is not driven by my gender. Some of my attributes are, and I think those are what would help to bring the balance. So we had to fight this reality that either men didn't belong or that we were different. Well, we are different, but we're not different as nurses. One more thing I'll point out, my daughter is a nurse, and when she was a student nurse, she won a scholarship and studied in Europe for the summer. And part of the program she was in, they went to this international nursing conference, and some nurse in England was speaking, some world-renowned nurse, and used the statement that the nurse of the future must be a superwoman. And of course, the politically correct American girls and a few guys that were part of her group said, "You mean super person? Superwoman. There's no room for men in nursing." Well, this, of course, offended my daughter. She came home and proceeded to write her senior paper on the role of men in nursing, researched it extensively, interviewed some 25 or 30 men in nursing locally and across the country, and wrote this paper, and it was entitled "Caring Comes from the Heart." That it wasn't about our gender that made us capable of being nurses. It was our hearts and our minds and our ability to care for people. And I think it took a while for the profession to realize that. For years, I battled what I call, I'm sure many women, and hopefully you didn't have to, but you may have, had to battle the glass ceiling. Well, in nursing, we had the stained glass ceiling.
Right.
And basically what that said was any man could do anything he wanted in nursing as long as he still reported to a woman. That's changed. There are now men I know who are directors of nursing and men who are deans of nursing schools. But that was a long time coming to prove that we could do the job. So it's a profession that I've loved to be part of, and it has given me entree to things that I could have never had entree to in terms of professional opportunities. I chose to take the non-traditional route and did most of my work outside the hospital, but my credential for everything I did was I was a nurse.
Right. You said when you started going to nursing school that only 1% of nurses in the country were men. How has that changed today? And do you think that, I mean, obviously, I think there is still some stigma against it, but how do you think it's different for male nurses today than it was for you?
Well, now there are 11.5% of the nurses are men.
Still low.
Which is a big step in the right direction. The AAMN, the American Association for Men in Nursing, has a goal of 20% by 2020, which is a great goal. And they've done a great job now of trying to recruit men into nursing and have people understand the value of diversity and gender balance in nursing. I think many men are finding that nursing is a phenomenal career opportunity financially. There are very few unemployed nurses, if any.
Right.
Nursing salaries have gone up dramatically and provide a good salary. I think the base salaries are starting now for between $40,000 and $60,000, and I know nurses making well over $100,000, which is good. And I know some nurses making more than that. But the reality is that the salary opportunities have changed, and the opportunities to use that credential to do various and different things. We're finding nurses in many different roles, some related to healthcare, some in other entrepreneurial activities that nursing prepared them for. I started my own company in 1980, and I had no business background, but my nursing credential and my ability to interact with people and to plan helped me to start a business that was not a multi-million-dollar business, but I made a good living up until I retired 2 years ago. And it gave me the opportunity to travel. I've taught in 25 countries. So the reality is, again, that as more men have entered the profession, have succeeded in the profession, have become role models to other men. One of my great joys are several times in my career when somebody comes to me and said, a guy who said, Frank, I'm a nurse and I followed in your footsteps, or you inspired me. And I didn't even know who it was, but somehow they knew that a guy did something that they wanted to do, and they did it.
Right.
So it's changing. The gender roles have changed somewhat in society, and so I think there's a greater acceptance. There's never been a problem, I might add, in the hospital. I've never had a patient not want me as a nurse because I was a man and they were a female, or vice versa. I've had some guys complain that I wasn't pretty enough, but that's a different story. The reality is that we're able to do the job and to do it as well as our colleagues.
Do you think that, when one of my questions for you was, why do we need more male nurses? And you already kind of touched on the balance between male and female and the differences and how they work better together. But do you think that there are men that are more comfortable having a male nurse?
Well, it depends on the role. I worked in emergency nursing when I worked clinically. And I would have women later tell me, how in a crisis situation, they preferred having a man. They had this feeling that they were more secure. In a non-crisis situation, I'm not going to put you as my patient in an embarrassing situation, and I'm going to put myself in an embarrassing situation, nor would a female put a male in that situation. So that the patients themselves didn't have a problem. Although I will tell you, early on there was a problem with men in nursing schools getting opportunities to take care of female patients, especially in maternity or gynecology. A guy I knew who was a couple years older than me who had gone to nursing school was in fact banned from working in obstetrics, and his goal was to become a nurse midwife, and he did become the first male nurse midwife in the country. But it was like, well, women don't want you in there. Well, I beg to differ. They wanted a nurse, and if you could do the job, that's what they cared about. The other side of that is that, and a statement I've made many times, the majority of our patients and clients are not young or middle-aged white females.
Right.
So we need a diversity in the population so that together we can help to, not that we need to have this, I need to take care of men and black nurses need to take care of black patients and Chinese nurses need to take care of Chinese patients, but by working as a team, we get to understand some of the cultural differences and some of the ethnic differences that will help us deal with what that patient. And, the real mantra in most hospitals now is what we call team nursing, nurses working as a team. Well, that team needs to be diverse in its outlooks and in its people, so that together they can do the job of giving patients the best care. It's all about patient care. That's right. The number one motivation to have this profession, not professional opportunity. That's there, but it's about patient care. If you're only in it because it's a business, you're in the wrong business.
Right. Absolutely. So how did you get involved with American Association for Men in Nursing, and why is advocating for male nurses important to you?
One of the professors at my alma mater, Widener University, I'd been asked by the dean to sit on the nursing advisory board there, and met one of the professors at the School of Nursing who had done all of her doctorate work on gender diversity and the role of men in nursing. And she was anxious to get a chapter started. And I didn't even know about AAMN until she introduced me. So together we helped to start the chapter. We call it the Greater Philadelphia chapter at Widener University. We had a great participation from. Oh, by the way, it's not just for men to be members. It's not the American Association of Men in Nursing. It's the American Association of Men nurses, but men in nursing. So it's helping to promote the idea of gender diversity.
Right.
So we had females as well. The predominant membership was, of course, the students, as is true in most of the chapters at AAMN. But there are some of the chapters that have very strong participation of the graduates. And unfortunately, one of the failures of our chapter is we just couldn't seem to get the young graduates in the area to take an active role for a variety of reasons. One of them time and their busy clinical and personal lives. But it was something that we started. We began to help the guys in nursing school begin to understand that their role was as nurses, and that other nurses had made it successfully, and that they could too, that they had a contribution to make. One of the things that also drove me to help start the chapter is the Dean of Nursing, who I had become friends with when she asked me to become sit on the advisory board, shared with me a statistic that was, to me, mind-boggling, that the dropout rate for men in nursing school is 3 to 4 times higher than women in nursing school. And that's a big, so we're getting more men to enroll in nursing school, but a lot of them aren't staying. And part of that is because the way they're perceived and or the way they perceive their treatment, somewhat real sometimes, and sometimes maybe imagined, but the reality is that there's this stigma, that guys don't belong here, or that women in nursing leadership roles, and the academic leadership roles, the professors, didn't know how to relate to these guys. At one point in my nursing education, I had never had a single male professor, and of the females I had, they generally fit into 4 categories. They were old maids, widows, gay, or divorced. So it was kind of hard to have a professional relationship with a woman who had no relationships with men outside of in their personal lives. And that was seen as awkward. And I can remember my toughest professors on me were the women who were divorced. They were tough on the guys, and I don't know why they took it out on us, but they did. So that my goal in helping to start the chapter was to show that it needs to be diversity, and that guys could do the job, not just academically but professionally, and that that there was a future for guys to do that. When I retired 2 years ago, I was involved in a number of activities and organizations and boards, and so one of the ones that I chose not to continue in as part of my retirement plan was AAMN, but I knew I had helped to start a good chapter, and I really don't know what the chapter is doing now, but I continue to meet men in nursing. I tell them about AAMN, and there's good literature there. There's resources to again advocate to help in this gender balance. The mission of AAMN, I might add, is that it's simply said to shape the practice, education, and research and leadership for men in nursing, and to advance men's health. One of the other factors here is that a lot of men's health issues needs to be promoted.
Right.
Very grateful for the advances in breast cancer treatment. But a lot of that was driven by nurses who promoted women helping to get involved in this because it wasn't it wasn't a big issue. Well, now it's a very big issue, and it's become, I think, somewhat politicized, unfortunately. But being the husband of a woman who's made it now through breast cancer for 8 years, I'm very grateful for what the breast cancer movement has helped to initiate. But when's the last time I heard about a prostate cancer initiative? Right. And more men die from prostate cancer than women from breast cancer. There are men's health issues. Men tend to be very closed-mouthed about their health. They go to the doctor at the last minute, and they tend to be macho about their health care needs. And we need to somehow get them out of that. One of my very best friends I've been working on now for 10 years to go get a colonoscopy. And I don't go to the doctor, Frank. I'm okay. There's nothing wrong with me. And that's unfortunately a typical male mentality, and it does impact men's health. So the reason of the association is not just to get more men in nursing education and research and leadership, but to also help promote and advance men's health in general.
Sure. Is there anything else about male nurses that I haven't asked you that you think is important to share? Any statistics that you think that are not well known that should be?
There are very few recruitment programs targeted at men. I, in the past, have made gestures to nursing schools I had contacts with that I would be more than happy to go out on recruitment days at high schools and talk about nursing. And no one would take me up on it. In fact, if you go to a health fair, you'll rarely see men in nursing promoted at career fairs at high schools, even at colleges. That's changing. There are some efforts now, especially in the Midwest, that have been very successful at recruiting men into nursing. Men need to be made aware. We need to recruit them, and not just hope that serendipitously they meet a guy in nursing who stimulates them or motivates them to want to go. So that's a really important thing to help increase the number of men, is that to be aware that we need to target in career motivations those people who have both the academic and emotional talent to want to get into nursing.
Yes. Well, thank you so much for sharing with me today. I really appreciate it. I'm sure we could talk about this for a long time, but you've shared a lot of really good insight, and thank you again just for taking time out of your day to talk.
Happy to do so. Best wishes to you.
Thank you.